Good morning, everyone. It's a great pleasure for me to be with you and to present some ideas about climate change and health. My task is a little bit difficult and a little bit easy because Professor Kish mentioned quite a lot of things in his introductory speech. But let's see what kind of data are available and what kind of conclusions can we draw from these data. First of all, I would like to call your interest about the 7th Ministerial Conference on Environment and Health, which was held in Budapest in July, where a triple crisis was mentioned as tackling environmental pollution, the loss of biodiversity, and climate change. And I would like to share with you this very small video message which was presented for the ministerial conference, just to give you a flavor about this threat in the, or maybe it's, we tried it before and it was working, but let's see whether we can see. Okay, so so this was the message of the 7th Ministerial Conference, and in the declaration there are some comments and some ideas how to proceed in the future. So, climate change. There are climate drivers. This is the temperature, precipitation, extreme climate events. Then biological diversity is impacted by the climate change, and also there are social factors, resilient, vulnerable communities, which just give the reason for the accommodation, acclimatization to the impact of climate change. And you can see that health impact is in the center of this interplay, interconnection of these different drivers and resilient factors. Climate change effects on public health. There are 9 different targets of this impact, as we have heard already. Diseases carried by vectors, allergens, mental health and stress situations, foodborne diseases, air pollution, floods, food security, wildfires, and temperature extremes. As you can see on this picture, there are very, very solid evidences that the temperature is increasing. As you can see, this time series from 1950 to 2020, and you can see that there is a definite increase in temperature. And on the European map, on the left side, you can see the degree of increase of temperature by the different countries, and in the middle we can see Hungary, and as you can see, we just experienced 0.9 to 1.2 degrees of centigrade increase in the last century. But you can see that the Scandinavian countries have even more impact concerning the temperature increase. How can we, yeah. Oh, excuse me for these problems, but I try to go further with my slides. Here you can see the extremes of the latest year, of this year, 2023, where there was an announcement from the Copernicus Climate Change Service that the global average temperature in July was the ever highest recorded temperature, and this is quite threatening notice and not threatening news. And as you can see, the heat waves in July with the extremes, which just hit the Mediterranean countries and also Budapest and Hungary. Wildfires, they are also very common in the latest years. As you can see, this year there were a lot of wildfires in Portugal, in Spain, and also in Greece, and in Italy, in Sicily, and we were lucky this year, but in the last year we also had a lot of wildfire cases. So it's also a great threat. Then we have to get acquainted with the tornadoes. As you can see, that there were tornadoes in the previous year in Hungary. This shows us the situation in 2022, where we could see 14 tubus tornadoes all over the country. And in this time series, we see a definite increase in these concerning this weather event. Who are the vulnerable population? You can see that the less able pregnant women, already infirm, the poor, displaced people, children, elderly, and we should not forget about athletes who are exercising in the outdoor, and they are just having an impact of the very high temperature. And we should also consider the outdoor and manual workers. And you can also read how many people, how many million people are just in case of this weather situation. Heat-related mortality is the greatest impact in Europe. If we think globally, infectious diseases, foodborne diseases, vector-borne diseases have a higher burden of disease and impact of mortality, but as concerning Europe, the greatest impact is heat waves. This map shows us the cumulative relative risk of deaths in the last year, and you can see that the Mediterranean countries were very much exposed. And the heat waves of the last year in Hungary can be seen from this picture. We can see that there were 4 heat wave alerts in Hungary, altogether 24 days with very high temperature. And 1,200 extra death cases can be attributed to these events. And we can see that during the past years, between 2015 and 22, the average number of excess cases was more than 600. So it's not a great number, but if we have to deal with this problem every year, then it will accumulate to quite a high amount of excess mortality. Then some words about infectious diseases. As you can see, 58% of human infectious diseases can be worsened by climate change. And this graph just gives us an overview about the risks and the possibilities, what kind of viruses, bacteria, protozoa can be infected by the climate change, and what kind of situation can be worsened. Vector-borne diseases play a great role in this impact. As you can see, climate change changes the transmission biology, it causes ecologic changes, social changes, and epidemiological changes, for example, concerning host physiology, disease morbidity, and so on. But we should keep in mind that vector-borne diseases not only depend on climate change, on the increase of temperature and the precipitation, but also transportation and mobility. And we can see that for example, 99 cases of malaria are related to travels. So in Europe, autonomous cases are very seldom, but the imported cases increase from year to year. And we can expect other emerging diseases appearing in Europe as well. The burden of pollen and allergy should be also mentioned. Pollen allergy is also one disease of very high public health relevance of the 21st century. You can see that more than 150 million people have pollen allergy in Europe, and this is the 20% of most prevalent chronic diseases in Europe. So we should keep in mind that this is related to airborne allergens. And this map shows us the most important airborne allergies in the middle part of Europe. This is ragweed allergy. On the left side, we can see the present situation. The center of the problem is Hungary and the Carpathian Basin, but in the far future, this problem will escalate to the whole of Europe. So we should do something in order to decrease the risk of allergic diseases. So if we go back to this picture, I would like to call your attention that there are risks, exposures, vulnerabilities, and there are impacts which can be modified by the resilience. If we increase the resilience of the healthcare system, social care system, and also the resilience, the public resilience, then we can a little bit mitigate the impact of climate change. One of the major things is the impact of climate change on the health and social care system. As you can see from this very nice picture, there are a lot of problems and a lot of targets where climate change can affect the management capacity and workflow of the healthcare system. I would like to call the attention on the disruption of health services, supply chain, energy system impacts, patient care impacts, and so on and so on. So when we would like to increase the adaptive capacity, then we have to strengthen the resilience of the health and social care system. What is the role of the healthcare personnel? There was a side event during the 7th Ministerial Conference organized by the Euro Health Net, and there was a statement that healthcare personnel and health policymakers are well placed to become sustainability champions and can make a big impact. What kind of impact can we do? We can avoid doing harm. Healthcare is in a unique position to address climate change. and we also have to seek for the solutions how to decrease the economical, political losses, and how to increase the influence on policymakers. So, last but not least, I would like to call the attention that there are also some co-benefits when we just doing the efforts to increase the adaptation capacity. So there are some examples of interventions. For example, we should like to concentrate on produce more renewable energy, improve insulation in houses, encourage the use of lower emission vehicles, promote active transport, reduce solid fuels for cooking, less food from animal sources, encourage local produced fruits and vegetables. And by taking all these measures, we can mitigate, we can lower the impacts of climate change, and just enjoy the direct and indirect benefits of this kind of adaptation process. And I would like to mention the coming COP28 meeting, where there will be the first health day on the UN climate conference. And a declaration is being prepared on climate and health with the most important messages, like strengthening and the development and implementation of policies that maximize health gains from mitigation and adaptation actions, facilitating collaboration on human, animal, environment, and climate health challenges, recognizing that healthy populations contribute to and are an effect of climate resilience, and improving the ability of health systems to anticipate, implement adaptation interventions against climate-sensitive diseases and health risks, including bolstering climate health information services, surveillance, early warning and response system, and a climate-ready healthy workforce. And I think this is the major point where we can connect our activity to the Declaration of Climate and Health. I mean, these are the main strategical aims of our climate project. So I should like to thank your attention, and I think you will be also champions of the struggle of adaptation against climate, the impacts of climate change. Thanks again.